Good morning, everyone, and thank you for joining us today on this very important day. Today is International Women's Day, and the theme for International Women's Day is courage. And today we have a very, very special person joining us, Anita Wolf, her husband Tom, and her daughter Jennifer. And she's really emblematic of a profile in courage. Here at the Northwell Health Cancer Institute, we treat more New Yorkers with cancer than anyone else. Over 19,000 patients a year are treated in our 23 hospitals and our 9 ambulatory cancer centers. And we are committed to bringing the most cutting-edge and advanced clinical trials to our patients. And today we are happy to report on the successful treatment using a brand new form of therapy, pressurized intraperitoneal aerosol chemotherapy, or PIPAC. We are the second institution in the United States to use this treatment for patients with colorectal cancer. I hope that on International Women's Day, Anita's story will inspire all of us, especially with the theme being courage, because I think your story is nothing short of remarkable. And what I'd like to do now is introduce the Northwell Health Cancer Institute Director of Colorectal Surgery, Dr. Larry Whalen, who was responsible through his tireless efforts of bringing this incredible advanced treatment to the patients treated in our system. Larry, thank you very much.
Thank you, Dr. Barakat, for that introduction and also for mentioning Mrs. Wolf and her family. I'd like to first start by thanking Anita for coming in and for her family to come in as well for this, but more importantly for having the courage to be the first patient to join the trial on the East Coast. And it's been our pleasure to treat you. We will continue to treat you as you go on. I'm going to switch over to the PowerPoint right now, if I could. So this new treatment is called Pressurized Intraperitoneal Aerosol Chemotherapy, or PIPAC. PIPAC is a new method that directly applies chemotherapy to cancer deposits in the abdomen and has fewer complications and side effects than conventional cancer treatments. This groundbreaking method was invented by a Swiss surgeon, Dr. Marc Raymond, whom I have known for over 20 years. When we first met, we were both doing research regarding laparoscopy and cancer. We fell out of touch for a decade until by chance we met at a meeting 4 years ago. It was then that I learned about PIPAC and was immediately fascinated about the idea of giving chemotherapy laparoscopically. To determine the physiologic effects of PIPAC on the entire body and to compare it to the more invasive and surgical alternative, Dr. Raymond and I are now doing a study in which my lab at Northwell will analyze blood specimens from European patients undergoing the PIPAC, which is minimally invasive, and also patients who had the more radical surgery. That in Europe, this has been used for about 5 years, and this is now the first time this is being brought to the U.S. PIPAC is being used to treat a condition called Carcinomatosis, which occurs when tumor cells break free from an abdominal cancer and implant on the surfaces that line the abdominal cavity. A variety of tumors can lead to this condition, including ovarian, stomach, colon, and rectal cancers, among others. It is estimated that at least 28,000 Americans each year develop this problem. Unfortunately, only a small percentage of patients can be cured. Therefore, the goal for most patients is to slow tumor growth, prolong life, and to preserve the quality of life. Because it is usually not possible to surgically remove all of the cancer deposits, most carcinomatosis patients get treated with intravenous chemotherapy, which subjects all organs in the body to high levels of the drugs, which not infrequently leads to side effects and complications. PIPAC is a new method that delivers chemotherapy directly into the abdomen and onto the cancer deposits. The chemotherapy is first converted into an aerosol that is laparoscopically injected into the abdomen. The aerosol is injected under pressure, which pushes the chemotherapy deeper into the cancer cells. If we could go to the video of Mrs. Wolf's case. This just shows the moment when the pen, the device that makes the aerosol, has been introduced into the abdomen, and you see the chemotherapy as an aerosol form being introduced, and it creates this snowstorm effect, which is quite impressive. And the idea of this is that the chemotherapy will be better distributed because of the pressure, and also it's in a gas form, so it'll reach all parts of the abdomen, which is what we want in order to reach all the tumor deposits that are there. Back to the PowerPoint, please. Now, because IV injections are avoided, only mild increases in blood levels occur, and they resolve within 3 to 4 hours. PIPAC is usually well tolerated, and the rate of complications and side effects are notably lower than with standard chemotherapy. Other advantages of PIPAC are that it can be completed in 1 to 2 hours, and that most patients are discharged within 24 hours, which means more time at home with family and loved ones. Importantly, PIPAC can be repeated every 6 weeks. Further, if desired, PIPAC can be given in addition to chemotherapy, in which case the tumors are being attacked from 2 directions. The Northwell Health System is the second in the U.S. to offer PIPAC. The Phase 1 trial Northwell is participating in is being sponsored by the City of Hope Cancer Center in California. Consenting patients accepted into the trial will receive 3 PIPAC treatments over an 18-week period. This trial is limited to patients with ovarian, gastric, colorectal, and appendiceal cancers who develop carcinomatosis. We did the first East Coast PIPAC case at Long Island Jewish Hospital on February 8th. To get to that point, we needed the help of many people from a variety of departments, including the Cancer Institute, the Department of Surgery, the OR staff, pharmacy, research, and hospital staff, plus others. And we're very grateful to their support to help us get to this point. Dr. De Peralta and I did the first procedure on February 8th, and we were assisted by Dr. Jill White. Dr. Danielle De Peralta is a surgical oncologist who is Mrs. Wolf's primary doctor, and Dr. White is a GYN oncologist who's going to be taking care of the patients who have ovarian cancer who enter into the trial. To tell you more about the procedure that went on with Mrs. Wolf and how she's doing now, I'd like to introduce Dr. Danielle De Peralta, who is the surgical oncologist who's on that case and who is part of our PIPAC team. Danielle?
Thank you. Thanks, Dr. Whalen, for the introduction, and thank you all so much for this opportunity to discuss the PIPAC trial and Mrs. Wolf. My name is Danielle De Peralta, D-A-N-I-E-L-L-E. Last name is D-E-P-E-R-A-L-T-A. I'm a surgical oncologist and hepatobiliary surgeon at Northwell. I first met Anita Wolf back in December 2020. She and her husband Tom came to my office to discuss some of her surgical options for treatment of her stage 4 colon cancer, which had spread to the peritoneum, which is the lining of surfaces along the intra-abdominal cavity. Specifically, her medical oncologist was hopeful that she would be a candidate for an upcoming PIPAC trial that Dr. Whalen and I had been working to bring to Northwell. It turned out that Mrs. Wolf was in fact an ideal candidate for this trial. She had initially been diagnosed with colon cancer back in 2019 during a screening colonoscopy. As some of you may already know, colon cancer is a very common cancer, and it's actually the second most common cause of cancer-related death in the United States. In its earliest stages, it's frequently curable, but once the tumor spreads beyond the colon, it becomes very, very difficult to treat. Since Mrs. Wolf's diagnosis, she had undergone surgery to remove the primary tumor in the colon, as well as a tumor that had spread to her liver. Despite this, she developed several areas of disease within the peritoneum, and these tumors were resistant to chemotherapy, even several rounds of very intensive chemotherapy. This suggested that an intraperitoneal approach, like PIPAC, where we spray the chemotherapy directly to the tumor surfaces, may prove to be a better option for her. Mrs. Wolf and her family carefully considered this option, as well as some other options. The timing of all of this ended up coinciding with the COVID-19 spike after the holidays in Long Island and across the country. Fortunately, I was able to still meet with Mrs. Wolf and her husband Tom on several occasions, and was even able to have a telehealth meeting with the entire family prior to making any definitive treatment plans. In all of my meetings with Mrs. Wolf, I have been deeply moved by her courage, her compassion, and her love for her husband and her children. Over the last year and a half, she's continued to thrive. This is in the midst of undergoing 4 abdominal operations and several months of chemotherapy. Whenever I ask her how she's feeling, she always just shrugs her shoulders and says, "I feel great." She doesn't feel like she has cancer or like there's anything wrong at all. Dr. Whalen and I performed Mrs. Wolf's first PIPAC procedure on February 8th. And I'm so incredibly moved to be here today to celebrate the 1-month anniversary of that procedure on International Women's Day. Today, we celebrate both Anita and her family, as well as all of our patients who have the courage to participate in clinical trials. Whenever a patient agrees to participate in a clinical trial, the hope is always that they will receive direct benefit from the trial. Unfortunately, we can't always guarantee this, but what we can guarantee is that agreeing to participate in these trials gives us the tools and the knowledge to help us fight these cancers and to better serve our future patients. And so thank you, Anita, both for your contributions to cancer care and for patients in the future, as well as for allowing me to participate in your care and to get to know you and your family. It's truly been my privilege. And without any further ado, I would like to introduce Mrs. Anita Wolf, Mr. Tom Wolf, and their daughter Jennifer, who's going to share some comments. Thank you.
Thank you, Dr. Peralta. Good morning. My name is Jennifer Zupan, Z-U-P-A-N. I'm so proud to be here with my mother, my father, my brother on International Women's Day. I love you. It's true. It all started because I encouraged my mom to get a routine colonoscopy. Nagging is probably the better word. And thank goodness I did. But no one ever could have thought, we never could have imagined that this was the road that we would be on as a result of that test. Cancer is such a scary word, and it's been a very difficult journey for our family this past 18 months. And COVID has exacerbated that. It's robbed us of time spent. It hasn't allowed me to travel from Connecticut to help my mom, to spend time to help my dad take care of her. The road's been tough, but my mom has never, ever wavered at all. In fact, I believe that as her cancer journey has continued, she's gotten stronger. Participating in this trial has empowered her. My mom has the most generous heart ever, and this trial has truly allowed her true spirit to shine through. Of course, we hope and we pray that the trial benefits her. It's all we ask for, but at the same time, we know that regardless, she's helping others along the way, and that's the most important piece. When asked to do the trial, my mom's first words in talking about it were, "Sign me up, let's do it." And she has not wavered from that notion at all. As a mom of 3 young girls, my husband and I strive to surround our daughters with powerful role models that they can hopefully be like. How lucky are they that their grandmother is such an empowered, courageous woman. Her courage in battling cancer and participating in a trial, it's a lesson we should all learn from. And hopefully, my mom will inspire you as she's inspired so many others. If you have the opportunity to participate in a clinical trial, please do. You have the opportunity to hopefully make change and progress for yourself, but the change you can offer to someone else is unbreakable. I love you so much. I'm so proud of you. And it is my honor and my privilege and my pleasure on International Women's Day to introduce my mom, Anita Wolf.
Hello. Take this off. Hello to everybody. It's a privilege to be here on this day of Women's Day. My journey on the cancer route started because my daughter Jen told me that I should go for a colonoscopy, which I did, and it came back cancerous. Never thought that would happen because I had no symptoms whatsoever. From that time, I had surgery. They took off part of the tumor that was attached to my liver, and I responded well. And after that, I went for numerous rounds of chemotherapy, a week on and a week off in Comac, and come to find out that after doing this for a whole year, that it really did nothing for the cancer that I had. Then I met with Dr. Peralta, and we decided to do the clinical trial. And with the clinical trial, I hoped that it would help me go through this and be fine, but I also wanted to be an opening block for other people that have the cancer similar to what I have. And hopefully it'll help people down the road. Oh, and now I'll introduce my husband, Tom.
Nice job.
Hello. I'm Tom, the husband of Anita, the father of Jennifer and Thomas, the grandfather of my grandchildren, my granddaughters, Sadie, Evie, and Maddie, and it's a privilege. This past year has been a roller coaster. You've heard about everything that Anita's gone through, and it's scary, and the numbers get scary. And yet, what's important is that, one, her courage, and two, she's not alone. She's got a team behind her, she's got a family behind her, and everybody pitches in. The other part of it is COVID. In a COVID world, there's things you can't do, but what she does is everything that's possible. And then what she shouldn't do, like lifting things at the wrong time, somebody else does for her. My son does shopping. My daughter visits with children with masks. And that participation helps. The courage of Anita is not just what she says and believes, but what she does through action. She lets people help her where needed, but everything that she can do, she does. And after a surgery or a round of the PIPAC, there's things that she shouldn't do. And yet, as she responds to that, she then starts doing everything she did before that she's allowed to. It's a positive action as well as a positive belief. And knowing that she's not alone and talking to people and laughing with people, family, friends, neighbors, it's a community effort that supports her and makes it easier for her to go through what she's going through. But she's the one that makes the decision to do it. She's the one that is the brave one, and pleasure to be married to Anita for 42 years.
43.
Actually, our anniversary is March 18th. It'll be our 43rd anniversary, and I'd like to present you with this. You can't see her crying, but that's okay. Thank you. Doctor, thank you very much.
Thank you.
Put that in the bucket. Thank you.
Wow. If that doesn't inspire you, I don't know what will. International Women's Day, the theme, Women with Stories of Courage. Anita, you epitomize courage. You are the first person outside of California at the City of Hope to undergo an experimental form of therapy. And if that doesn't speak volumes about your courage, I don't know what does. And really, I can't tell you how grateful I am to be here today and to have met you and your beautiful family. And I think this journey takes an incredible family, and you clearly have the love and support of them. So I really also want to thank our doctors. I'm blessed to lead the Cancer Institute at Northwell, but I'm surrounded by incredible talent. And I know how hard Dr. Whelan worked to get this trial here, and I know the incredible job that Dr. DiPeralta does in taking care of her patients. I think her humanity comes through and shines through, and that's seen in the relationship she has with your family. The Northwell Cancer Institute is here to help you and all of those 19,000 patients on a yearly basis that we take care of and that we're proud to take care of. So we want patients to come and see us and not be afraid of COVID-19 because, frankly, one of the other victims of COVID is cancer, is patients developing cancer and presenting with more advanced stage disease. Colon cancer and breast cancer are two of the most common cancers we deal with, and the National Cancer Institute estimates that there will be 10,000 increased deaths due to these cancers from patients not going for screening. So we really encourage our patients to not be scared. We are taking absolute precautions to protect our patients and our staff with testing, with social distancing, with mask wearing, because you must go for your screening tests, and you cannot avoid doing that. So we strongly urge you to do that. We do not want the next casualty of COVID to be cancer. But again, most of all, I want to thank you, Anita. Again, our hero.
You're welcome.
Epitomizing courage for you and being here today with your family and the great support that they've demonstrated. And of course, happy anniversary. I think it's your birthstone, that correct? Gemstone that you gave her. So happy anniversary. Again, thank you. We're proud of you, and we wish you the best of health and a long life. And at this point, we'll see if there are any questions from those attending this conference.
First question, Jennifer, can you explain the importance to the family, your feelings about your mom being willing to participate in a clinical trial on this day of courage?
It's the most amazing thing to watch. Like I said, she has this heart of gold. Anyone who's met her knows that. So this just sort of follows that path for her journey. The fact that towards the end of your life, as you get older, you get to almost be in your moment and show the world that generous spirit that we all know. It's scary how to participate in a clinical trial. No one will take that away from her or from anyone. But that courage that she shows without hesitation. It was never a hesitation about participating in this trial. It was probably secondarily helping herself, but more so that idea of helping others, which she's done her entire life. So to be able to show that in this way, it's her legacy.
Anita, same question. What do you think about having been involved in a clinical trial, first on the East Coast? What is your feeling about that? How has it brought you even closer with your family?
Well, I said that I would do it because it is a clinical trial. If it helps me, I'll be very, very happy. But if it doesn't, then all the people that will come into the trial after me, because it is brand new on our coast, will be able to hopefully get over the disease and survive the aftermath of having cancer.
Last question is for Tom. Without spilling the beans, what are your plans for the anniversary?
Actually, what we'll end up doing is having a really nice dinner and then making plans once we're able to have a dinner out with family and just have a good time. But some things can wait for the proper time. And yet we will do some laughing and have some fun. And I guess one of the really neat things is we have albums of pictures of history. And Jennifer needed some baby pictures for something.
School.
And we started looking at our own pictures of that time period. And it's fun to remember where you came from and what you did. And our son Thomas and Jennifer just make it a family, and it's fun.
Okay, well, thank you again, everyone, for being here, and we're glad we were able to share this incredible story of courage on International Women's Day. Anita, thank you, and thank you to you.
Well, I want to just thank everybody that's here and made this possible, because it's just a special day.
Thank you.
Thank you.
Thank you.